Do you find yourself waking up 3, 4, or even 5 times a night just to use the bathroom? It's a frustrating cycle that leaves you exhausted the next day. Most people assume the problem is their bladder, that it's shrinking with age or becoming overactive. But for many of you, the problem isn't in your pipes or your bladder at all. The real culprit is often hiding right in your legs. It's a condition called peripheral edema, where fluid collects in your lower extremities during the day and only decides to leave once you lie down. Let me tell you about a patient of mine. Let's call him John. John was 68 and was convinced he needed prostate surgery because he was up every 2 hours. We looked at his bladder and it was fine. Then I looked at his socks. John had deep rings around his ankles from his socks every evening. That was the smoking gun. His legs were acting like a reservoir, holding on to gallons of fluid that his body couldn't process until he was horizontal. Think of your legs as a sponge. Throughout the day, as you walk and stand, gravity pulls fluid down. If your veins aren't pumping perfectly, your legs soak that fluid up like a sponge in a bucket. But here's the kicker. When you lie down to sleep, the gravity holding that fluid in your legs disappears. The fluid flattens out and flows back toward your heart and kidneys. Your kidneys see this sudden surge of fluid and think, wow, we are overhydrated, time to work. They start filtering that fluid immediately, filling your bladder over and over while you're trying to dream. Let's bust some myths. Many people try to stop drinking water after 4 p.m., but they still wake up to go. Why? Because the water is already inside you. It's in your legs. Restricting water won't fix a fluid retention problem. Here is a self-test you can do right now. Press your thumb firmly against your shin bone for 5 seconds. When you let go, does it leave a pit or a dent that takes time to disappear? If so, you have pitting edema. Now for the practical hacks. The gold standard is elevation, but you must do it before bed. Spend 1 hour in the late afternoon with your ankles higher than your heart to let the drainage happen while you're awake. Next, look at your salt intake. Salt acts like a chemical magnet for water. If you have a high sodium dinner, you're essentially inviting your legs to soak up even more fluid that night. Compression socks are your best friend. They provide the squeeze your veins might be missing, preventing the fluid from pooling in the first place. Put them on the moment you get out of bed in the morning. Movement is medicine. Your calf muscles are like a second heart. Every time you take a step, they squeeze the veins and pump that fluid back up against gravity. Even simple ankle pumps while sitting help. Consider your potassium levels. Potassium helps balance out the sodium in your cells. Increasing your intake of leafy greens and bananas can actually help your body manage fluid more efficiently. This is critical. While leg swelling is common, it can sometimes signal red flags. If you have swelling in only one leg, shortness of breath, or chest pain, you must see a doctor immediately. It could be a clot or heart failure. Check your medications. Some blood pressure drugs, like calcium channel blockers, can actually cause leg swelling as a side effect. Never stop your meds, but do discuss this with your physician. Let's summarize the dry night checklist. Elevate for an hour before dinner. Wear compression socks daily. Walk for 20 minutes. And keep your evening meals low in sodium. Consistency is key here. Imagine waking up after 7 hours of uninterrupted sleep. You'll have more energy, better focus, and a much lower risk of falling in the middle of the night. It's life-changing. I get a lot of questions about this. People ask, how high is high enough? Or, I'm not overweight. Why is this happening? Let's address the most common concerns right now. Your ankles need to be above your heart, not just on a footrest. And for socks, starting with 15 to 20 millimeter scarings is usually enough for most people to see a significant difference in nighttime trips. You don't have to accept poor sleep as a part of aging. Take control of your fluid levels, and you take control of your nights. You've got this, and I'm here to help you every step of the way. To truly understand why this happens, we need to talk about your veins. Unlike your arteries, which have the heart to pump blood out, your veins rely on valves and muscle contractions to get blood back up from your toes. As we age, these valves can become leaky. Instead of a one-way street, blood starts to pool in the lower legs. This increased pressure forces fluid out of the blood vessels and into the surrounding tissue. That is the edema you see in the mirror. There's also a fascinating link to sleep apnea. When you stop breathing, your heart is stressed and releases a hormone called ANP. This hormone tells your kidneys to dump water immediately. So, if you're snoring loudly, that's another piece of the puzzle. Many patients have both, edema in the legs and undiagnosed sleep apnea. Solving one helps, but identifying both can completely transform your sleep quality and your overall cardiovascular health. Let's look at more exercises. Beyond walking, you can do calf raises while brushing your teeth. Simply rise up on your toes and back down. This activates the calf pump, which is essential for venous return. Aim for 3 sets of 10, 3 times a day. It takes less than 2 minutes, but can significantly reduce the volume of fluid that accumulates in your ankles by the time evening rolls around. If you're sitting for long periods, maybe watching TV or on a flight, do ankle pumps. Point your toes away from you, then flex them back toward your shins. Keep that fluid moving. Avoid crossing your legs, as that restricts flow. Let's refine your hydration. Front-load your water intake. Drink the majority of your fluids before 2 p.m. This gives your body plenty of time to process and eliminate that water while you are still upright and active. We mentioned potassium, but let's be specific. Avocados, sweet potatoes, and white beans are powerhouses. They help your cells pump out excess sodium, which naturally reduces water retention. It's nature's diuretic. So, your new routine: compression socks on in the morning, drink your water early, do your calf raises, then an hour of elevation before dinner. This 1 to 2, 3, 4 punch is how you reclaim your 3 a.m. hours. We often think of lost sleep as just being tired, but for my patients over 60, it's a major cardiovascular risk. Chronic sleep fragmentation can lead to higher blood pressure and increased stress on the heart. It's not just about energy, it's about longevity. When you're up 4 times a night, your body never enters the deep, restorative stages of sleep, where your blood pressure naturally dips. This constant state of fight or flight puts immense strain on your arteries over years and decades. Choosing the right compression is vital. Most people start with 15 to 20 mmHg for daily use. If your swelling is more significant, you might need 20 to 30. Look for graduated compression. It's tighter at the ankle and looser at the top. Fit is everything. A sock that's too tight can actually block circulation, and one that's too loose won't help the sponge effect. I always recommend getting measured by a professional or carefully following a size chart at home. Let's talk about the nightcap. Alcohol is a diuretic, but it also causes blood vessels to relax and leak fluid into your tissues more easily. That evening glass of wine might be contributing to your 3 a.m. bathroom run more than you realize. Caffeine has a similar effect. Try to transition to herbal, non-diuretic teas after 2 p.m. This simple shift helps ensure your kidneys aren't being chemically stimulated to produce extra urine right when you're trying to wind down. If you struggle with stacking pillows, consider a wedge pillow. It provides a consistent, stable incline that prevents your legs from sliding off in the middle of your elevation hour. It's a small investment for a much better result. Consistency is your superpower. Your body loves a predictable rhythm. When you combine these habits into a daily routine, you're not just treating symptoms, you're retraining your system for better health. You can do this.